I appreciate you guys having me here today. A lot of you are friends from quite a while back, and if you don't know me, I've been in the life and health insurance business now for a little over 25 years. My primary focus is with seniors and helping seniors really get the best coverage for themselves, but also help them reduce some of their costs. One of the things that I really wanted to talk about, because it's making a lot of changes in their lives right now, is the cost of prescription drugs. Go back one, sorry. So I guess it was last summer. It actually went into effect, I think, the beginning of this year. But Biden has passed what's called the Inflation Reduction Act. It plays a role in a lot of things, but I'm just going to focus basically on how it's going to affect prescription drug costs in the future, because there were some really major changes made. The current law shows, and I hope you guys bear with me in this, because this is the busiest time of the year for me, and I have looked at this about 2 times in the last 3 or 4 months. So, current law, you've got 4 phases with your prescription drug coverage. If you're not familiar with them, there's the deductible phase. That's where you're really responsible for 100% of the drug cost until you meet that deductible. A lot of the plans today don't actually, they exclude generic drugs in most cases, so the deductible only applies to your brand name drugs. In the future, a lot of the standalone prescription drug plans that are out there now, the deductible applies to all drugs, and the deductible for 2024 is $545. So there's a potential that you would spend the first $545 before your prescription drug plan kicks in anything on those costs. So that's real important to know, and that's going to stay the same through 24 and 25. Once you get through your deductible stage, you go into what's called initial coverage. In most cases, those are small copays. It could be anywhere from 0 to a tier 3 drug maybe being like $47. In the future, you're going to see these insurance companies start to charge for tier 3 and above brand name drugs a percentage or a co-insurance. And Medicare will allow them to charge up to 25% of the actual cost of the drug. Now, first thing you got to know is the actual cost of the drug is controlled by the pharmacy benefit managers, and they kind of control the plans. So they have fake prices out there that they publish as this is our cost for this drug. But as an example, a $600 drug could cost a senior $150 a month if they were on the 25% initial coverage level. So that's going to be the same across the board, although once you get to your coverage gap, you've got additional pickup by the drug manufacturers. You can see 70%, 70%. I don't know if you guys can see the colors, but that's what that represents. And for the manufacturers, that's not actual dollars out of their pocket. They're basically just discounting those costs to the PBMs. So they're really not paying anything. And then you once you get over to the Medicare portion of what your costs or their costs are going to be right now, that's the whole point of the Inflation Reduction Act, is to try to get Medicare's costs down. They're currently paying 80% if you get into catastrophic coverage. Now, a lot of people do. In 2024, you'd have to spend about $8,000 to get to that catastrophic level. But Medicare's whole goal is to get over here to, in 2025, knocking down, I'm sorry. Well, I just jumped over. Knocking down the maximum out of pocket for seniors to $2,000. So that's good for most seniors, but generally you're going to get there a lot faster because Medicare doesn't want to get you into that catastrophic stage where they have to pay for it. These are some of the positives of the Inflation Reduction Act. Number one, the insulin savings program. It's been around a little while, but now all plans, it used to be just particular plans had to offer the $35 cap per month for insulin. In 2024, it's going to $35 for all plans, but the insulin that you're using has to be on their formulary list. So that's important to know too. Medicare is also going to now be able to go out to manufacturers and negotiate some of the high-cost drugs. Unfortunately, one of those manufacturers, Burch, has already filed lawsuits saying it's unconstitutional for the government to step in and try to control their prices. So it's probably not going to take into effect for quite some time. So it'll take years for that to really impact us. In 2024, the 5% that the client or the member has to pay once they hit catastrophic level, that's going to go away. So if any of the members get to that catastrophic phase in their prescription drug plan, they'll have no cost out of pocket after that. Vaccines are going to be covered, more of them. I don't know if anybody's looked into shingles vaccinations. Those are going to be covered in 2024 at no cost. Also, you've got all your other pneumonia, COVID, flu shots. Those are all included there at no cost. And then the max out-of-pocket 2025 is going to be capped at $2,000. So sounds good, but there are also some negatives involved. Number one, standalone prescription drug plans are going to start incurring more cost out of their pocket, especially in 2025. So we're already starting to see some increase in premiums. There's a number of plans this year that have gone, as much as double the cost. Some of them that were $40 or up to $80 a month in just premium alone. After 2024, they're capped. They can't increase their premium by more than 6% every year. So that's a little bit of protection, but that's why they made this big leap this year, so they could get them up higher enough to where it would allow them to keep climbing. And their point is we're paying out a lot more out of our own pocket. Percentages, we talked about that, are going to replace your copays. Most plans today, like I said, for a tier 3 drug, and those are pretty common brand name drugs, run anywhere from $42 to $47 a month copay. Soon you're going to see, in fact we're starting to see them now, but in 2025 I expect to see almost all of them have a percentage co-insurance, and it can be no higher than 25%, but there's some already today that are 16, 18, 20%, and there's a couple of plans that have already hit that 25% mark. The other way that they're going to try to control their out-of-pocket portion is they're going to have more prior authorization requirements, step therapies, quantity limits. If you're on a particular drug that your doctor recommends and it's not on the formulary, most of those plans are going to say, you got to try our drug first. So that's where step therapy comes into play to see if it'll work just as well as the one you want to be on. So they're trying to keep their costs as low. More and more people are going to be able to, or not be able to, they're going to be forced to hit that $2,000 limit. So it's going to be quicker for a lot of folks based on the premium, the percentages on their initial phase. And then a lot of formulary changes are going to take place. They only require these plans to include at least 2 of every drug class. Most of the plans today may give you 5, 6, 7 different options. In the future, you're going to see those starting to pare down to where you've got 2 options, and if it's not if your drug is not one of those 2 options, you're going to have to get a formulary exception or look for a different plan. So those are just some of the things that really are going to be affected negatively. Most of the people today are talking about standalone prescription drug plans. They're going to start utilizing that utilization management more than the Medicare Advantage prescription drug plans. And for a long time, it was kind of confusing to me, what's Medicare really trying to accomplish? Medicare wants to get seniors off of their roll. I mean, they're paying a lot of money for seniors as they grow older. They're not good at fraud, waste, or abuse, so their ultimate goal is to move as many people as they can to a Medicare Advantage plan. And if you're familiar with Medicare Advantage plans, that's not normally your best choice for health coverage. If you're looking strictly at health coverage, original Medicare with a supplement and a standalone prescription drug plan is going to give you the best coverage you can get. But with these types of changes, and with the cost of the standalone prescription drug plans going up, the percentages on the co-insurance going up, you're going to see a lot of people have to migrate to a Medicare Advantage plan with prescription drug coverage, which ultimately, in my opinion, is what they're trying to do. So, if you are in that situation, these are just some strategies that are available for you to use to try to control drug costs. Miriam, you probably looked at some of these types of things. Discount drug cards have been available for a long time. Most of y'all are familiar with GoodRx. Single Care is the one that I typically use the most. GoodRx actually merged in with, I think it was eHealth, but anyway, they capture your information and sell that data over to other marketing companies, call centers, things like that. Advisory Health is Kroger's new card, because they had a falling out with GoodRx. You can use it at other locations, but that's primarily their discount card. And then there's a new one on the market called Save on RX. If I were you, I would download both GoodRx and the Single Care app. You can have them on your phone. You can always check with the pharmacist which one's going to give me the best deal. And if they accept those particular discount cards, those are available for you. And that's generally going to be on your tier 3 generics. Brand name drugs really aren't going to have a big impact with these discount cards, or you won't have a big impact. I'm going to skip this one here. When not to use a discount card, brand name medications. They're just typically not going to be any better on a discount card than if you were just paying full retail price. There are some other options, and we'll talk about those in a second. And then if you're wanting your out-of-pocket cost to count towards your deductible or your true out-of-pocket expense, discount cards, when you use that, it doesn't really go towards your deductible on your plan or towards your true out-of-pocket cost. So those are the two times I really wouldn't use them. I sit down with a ton of seniors every day, every year, and that's been one of their biggest issues, is how can I control these costs? If you see advertising on TV today about a drug, it's going to be a very expensive drug. And so we've tried to find different ways to help people save money and still be able to get the drugs that they really need or the doctors recommend. Online pharmacies. Has anybody ever heard of Cost Plus drugs? Cost Plus is Mark Cuban's new venture. He does a true cost-based model where it takes the actual cost of the drug, adds 15% to that, that's what the drug would sell for, and he charges you shipping. And he's been adding more and more drugs as we go along. In fact, he's working on a pilot program. I mentioned the $35 cap on insulin. He's actually trying to get a $25 cap on insulin through Cost Plus drugs, primarily for people that don't have any insurance at all. If you've got the Medicare standalone prescription drug plan is $35, it's still a really good way to go. Eagle Pharmacy, this is just an example. That's actually a typo, but this Synthroid, the actual brand name Synthroid, a lot of people take levothyroxine or thyroxine. That's available through Eagle Pharmacy for only $75 for a 3-month supply. That's a huge savings for a tier 3 drug that would normally run, like I said, $42 to $47 a month, about $135 for a 90-day supply. And then RX Outreach, just another place that you can send people to, primarily for people with no insurance at all, but they do discount generic drugs and they can get them down pretty low. I think these two actually will provide shipping at no cost. And then, if you're not familiar, there are patient assistance programs out there. Those are through the manufacturer. There's an income criteria in most cases that you have to meet. So there's eligibility. It does not go, you would pay $0 for the drug. It doesn't go towards your deductible or your true. So that has some effect on some people. Usually you get it for free for a year once they approve you, and you got to meet certain income levels there. And then if you don't know which drugs have patient assistance programs, you can always contact us and we can find out for you. But these are some of the common drugs like Humira, Skyrizi, Breztri, Trelegy, Eliquis, Xarelto. I'm sure y'all have all heard of those. They all have pharmaceutical or patient assistance programs where the manufacturers will get you set up at no cost. There are grants available. Usually grants are only good at the beginning of the year because the money runs out really fast. These are they're disease specific. So if you have a certain type of cancer, or if you have a certain type of I'm trying to think, pulmonary disease or something like that, those grants are available for that disease, not necessarily for the drug. They would give you a flat amount of money to spend on that drug until that money ran out. They usually have waiting lists. You can get on those. This time of the year would be the right time to do that, because then the funding comes in January, they start allocating that money out. Okay? And you can make between 400% and 500% of the federal poverty level and still qualify. Then the last thing I'll talk about is certified Canadian pharmacies. I literally have probably a dozen clients today that are having their doctors send their prescriptions directly to a certified Canadian pharmacy, and that's important because there's only certain numbers that go through that certification process. But a U.S. doctor can file or send a prescription up to Canada. It is quote-unquote illegal for them to send it back, but they do send back those prescriptions. Some of those are manufactured in other areas, but it's the exact same drug that you would get in the U.S. In fact, there's some of the drugs that we cannot get in a generic form that are available in Canada today, and that's where some huge dollar savings can come into play. So it's just another option. There's a ton of people doing it, and I literally have, like I said, about a dozen myself. This is just a list of some of the certified pharmacies. If you have questions about that, we can always get together and talk about it. Keeping it short and sweet, I figured if you had questions, Miriam and I will try to answer those for you. So anything come to mind, any questions or anything that you want to discuss about it?
You said that was illegal sending from Canada, yet they do.
Yeah, it's not really policed. It's like a lot of other speeding's illegal, and a lot of times people speed just because they need to get there. If somebody needs to get a prescription drug and they can't afford it in the United States, then they don't have what'd I say?
Speeding's illegal.
Okay. So that's their only option. Then I say let's make that available to them, and I do that.
You get caught with this way.
Like I said, it's not really policed. I mean, the only thing they would do is stop those at the border. Most of those are shipped or mailed, so it's never really been a big deal. In fact, most of the people in upper state New York have gone to, Canada forever for their drugs, just like a lot of people in Mexico, or a lot of people in Texas go to Mexico for dental work and other things. All that's not illegal, but I don't know that the FDA is really who kind of controls that situation, and they're kind of just letting it slide. I mean, they're not doing anything, so we utilize it. Yes, sir?
How do you go about applying for the grants?
Generally, with my clients, we sit down and do it together. You have to go to the website. There's a couple of different ones that are tied to the grants themselves. Most of my people don't go that direction. They'll go with the patient assistance program, where you go directly to the manufacturer site and pull down their applications. A lot of them can be done electronically. With the grants, you just have to find what disease-specific grant you're looking for. You can Google search that, and you can pull up those sites with the applications.
You mentioned the advantage. Well, the advantage plans are pushing more and more toward that.
Yes, sir.
Says currently you can get better care, health care overall under the original Medicare. What changes to the reason why you get better care under the
A big part of it is when you're dealing with a managed care plan with a Medicare Advantage plan, you got private insurance companies involved. Private insurance companies are out to make a profit, so they use prior authorization as a tool. They use network of doctors that they've negotiated down the prices. A lot of doctors get paid less from a Medicare Advantage plan than they would from original Medicare. So, I mean, there is no perfect plan, and everybody is a little different in what fits their needs. I've actually been on a Medicare supplement with a standalone drug plan. I'm currently on a Medicare Advantage plan. I don't utilize it a lot, so it's not a big deal to me. But I would never recommend to somebody that had a lot of health needs to move to a Medicare Advantage plan and absorb all of those co-payments for every service they provide. It's kind of paying in advance, that's your Medicare supplement program, or paying as you go, which is Medicare Advantage.
One of the problems we found with my mom with that Advantage plan, was they put limitations how long you can stay in the hospital.
Hospital's not as normal as a skilled nursing facility or rehab. Usually with a hospital, if your doctor deems it medically necessary, they're not going to be pushing them out the door. But a lot of hospitals will push them out the door because they don't like what they're getting paid anyway. Medicare doesn't do as much or is not as involved in doing the authorizations. They pretty much let it fly. If the doctor says it needs to be done, they're going to approve it and it's going to get paid for. With a Medicare Advantage plan, you've got somebody up there saying, prove to me that that's medically necessary. In skilled nursing facilities, a lot of times with original Medicare, if you've had a hospital stay, you can stay in a skilled nursing facility for up to 20 days, no cost to you. With these Medicare Advantage plans, they will say, you had a hip replacement, you can go there for rehab for 3 or 4 days, but then you need to go home. And the doctor has to keep submitting that authorization in. But for a lot of my clients, it's really also all about, can they afford a Medicare supplement? It's all a financial decision too. You gotta kind of blend them together.
One of the things that I found is that you have, with my wife, she had an issue several years ago. The same issue came up this year, and it getting rejected. She kept talking to the doctor. They said, everything since June that they've sent has been rejected until they figured out they were dealing with AI, artificial intelligence. And now they know how to play the game.
Yeah.
Because if AI looks at it, if they say, well, what's your payment level 1 to 10? And you say 5, they say, well, 7 is where it's got to be, or artificial intelligence is going to throw it out.
Yeah.
Nobody's really looking into this stuff other than AI.
Yeah, and that's a whole new game, and it is starting to be more and more prevalent with the carriers utilizing that kind of technology to make determinations. It was bad enough when they had somebody with no medical degree up there making decisions. Now they got nobody up there, just a piece of technology. But honestly, that's where agents get involved. That's where we start talking to the actual carriers, and we can help a lot with that. My biggest fear is people getting on the phone with call centers and signing up for a plan just because they get a flex card for their groceries or utilities. They have no concern about how it takes care of their health needs, and then they've got nobody to turn to when they actually do run into an issue like that. If you deal with a local agent, and my office is right here on the square, right almost across from Miriam's, we're here to help you when those situations come up. So that's it for me. Hopefully that was a little informative. It was a little rusty, but it was informative. I do want to tell you this one thing. My 6-year-old grandson told me a dad joke this weekend I thought was pretty funny. So why did the Scarecrow get an award? Anybody know? Because he was outstanding in his field. So I may not have been outstanding, but I hope you can relate to me as a scarecrow maybe? I don't know. Anyway, I appreciate you guys having me. Thanks.